Go.
Our group is presenting Functional Family Therapy. Our group consists of Margie, Danielle, Margot, and Denise. Functional Family Therapy was developed by Dr. James F. Alexander, who is a clinical psychologist who received his degree from Michigan State University in 1967. Dr. James Alexander administered a sequence of outcome studies to examine the efficacy and effectiveness of family-based interventions for delinquent adolescents. This is what we all currently know as family functional therapy.
So FFT is an approach that combines systemic and cognitive behavioral therapies. And so one of the main ideas is that it focuses on patterns within the family relationship to really identify what functions different behaviors actually hold within the family. And when a therapist is looking at the behaviors, they're trying to identify if they're either adaptive or maladaptive to see how they contribute to a family's ability to function. And then the goal of therapy is really to decrease the maladaptive behaviors and then increase the adaptive behaviors while maintaining the function of the family. And to do this, FFT has 5 distinct phases, which are engagement, motivation, relational assessment, behavior change, and generalization. And so in engagement, the purpose is to really engage all the family members and to make sure that they're all aligned with the expectations for treatment. And then in motivation, it's to create a context for change, right? You want to reduce the family conflict and blame and really begin to refocus family members' attention on their relationships and alliances with each other. And then relational assessment is really identifying what the purpose or function of specific behaviors are within a family and for individuals. And this is really crucial because these assessments will determine the actual design and implementation for the behavior change phase. And then the 4th phase is the behavior change, where you start to apply the interventions. And then the last is generalization, where the client starts to extend the skills that they've learned in therapy and the behavior change that started to occur to see if they can actually implement those same behavior changes in their home or outside of the therapy environment to really maintain or ensure that the client becomes independent from the therapist.
And 3 interventions are of FFT. One of them is relational assessment, which the goal of this phase is to identify the pattern of interactions within the family, to understand the relational functions of interpersonal payoffs for individual family members' behavior. The therapist focuses on eliciting and analyzing information pertaining to relational processes and assess each dyad in the family using perception and understanding of relational processes. The focus is directed to intra-family, so inside the family or external family context and capabilities. For example, values, attributions, functions, interactions, patterns, sources of resistance, and limitations. Therapist activities involve observation, questioning, interference regarding the function of negative behaviors, and switching from individual problem focus to a relational perspective. This sets the stage for planning in behavior change and generalization, where all interventions are matched to the family's relational function. That's relational assessment. The next one is engagement. The goal of this phase involves enhancing family members' perception of therapists, responsiveness, and credibility. Therapists work hard to demonstrate a sincere desire to listen, help, respect, and match to each family member in a way that is sensitive and respectful of the individual family and cultural beliefs, perspective, and values. The therapist's focus is on an immediate responsiveness to family needs and maintaining the strength-based relational focus. Activities include high ability, telephone outreach, appropriate language and address contact within family members as much as possible, which that is also the matching and a respectful attitude between the family members. The other intervention is generalization phase. So the primary goal for this phase is to extend the improvement that is made during the behavior change into multiple areas and to plan for future challenges. This involves extending positive family functioning into new situations or systems, planning for relapse prevention, and incorporating community systems into the treatment process, such as teachers, probation officers, etc. Skills include a multi-systemic or system understanding of the ability to establish, link, maintain energy, and provide outreach into the community systems. So again, it's like a systems theory. The primary focus is on relationships between family members and multiple community systems. Generalization activities involve knowing the community, developing and maintaining contacts, initiating clinical linkages, creating relapse prevention plans, and helping the family develop independence.
There are several aspects of the family functional therapy model that can be useful across cultures. For example, functional family therapy uses the strength-based model, focusing on families' capacities within relational processes. Functional family therapists build relationships with clients through respect and acceptance. Functional family therapists are also sensitive to cultural diversity. Although these aspects can be effective when working with a variety of families, there are some instances when FFT may not be appropriate for all client populations. For example, the FFT model has been known to be very successful when working with adolescent youth with behavioral or emotional problems. This model can be useful around issues of juvenile delinquency, substance use, and violence. This model may not be suitable when working with a middle-aged or elderly population. In addition, the FFT model is short-term, with treatment lasting from 3 to 5 months. This model may not be appropriate for a client who's interested in long-term treatment.
Thank you. We hope you enjoyed our presentation on functional family therapy.